The first is going to be platelet-rich plasma. The next is shockwave therapy. And then finally, we're going to talk about amniotic membrane therapy. First, I'm going to ask Dr. Feldman to talk a little bit about platelet-rich plasma therapy. So if you could first just start out explaining to me, what is platelet-rich plasma therapy?
All right, thanks, Don. Thank you for inviting me to the show. Platelet-rich plasma is also called PRP, and it's taken from your own body. We would draw blood from your arm, most likely your arm, and there's a centrifuge that we have in the office, and it'll get spun down. Plasma is your blood taken out of your body and spun so the red blood cells are separated out. The red blood cells are heavier, so they end up at the bottom of the test tube. And there's a yellow liquid. It's the blood components without the red blood cells that has, it's called plasma. And inside of that is a larger concentration of platelets. We take that and then we'll inject it into the diseased tissue, and the tissue being tendon, fascia, ligaments, or joints, or even bone for that matter.
And so with this platelet-rich plasma that you get, does everyone, if you take it from me and from Dr. Saviet and from yourself, are we all going to get the same amount and same quality of platelets?
No, it's going to depend on your body. Our platelet production is different for all of us at different ages, different cycles. It's based on a lot of different factors, how healthy you are, for instance. Some people have low platelets. Some people have excellent platelets. We don't typically get blood tests on people to determine their platelet count, but that's an area that could be explored. We're going to talk about it later, but that's what's so exciting to me about the amniotic membrane therapy, because it bypasses your own
using your own blood.
Using your own blood, and it saves the blood draw as well.
So once you have a patient and you take out the blood, you spin it down, you get this magic gold. Where would you want to inject it? Why this type of treatment and not a different type of a treatment, maybe like cortisone or something else like that?
Yeah, and in today's day and age, people are very leery about chemicals being put into them or anything that's going to be damaging or toxic to the body. Cortisone is wonderful. It's an anti-inflammatory, so it stops the inflammatory process. It can help reduce localized inflammation, and it can help with symptoms. There's no doubt about it. The problem is it also delays natural healing. It actually interferes with the body's natural healing response. Platelets are what promote the body's healing response. We want platelets to be called into the area because we want platelets to bring their growth factors, their special healing properties. They release their own stem cells. And stem cells are cells within your body that can become other types of tissues. They're called multipotent stem cells, so they can become bone, tendon, fascia, ligaments, joints, nerves. They can't become organs, not in today's day and age, not yet. Hopefully never, but or hopefully someday with the organs.
So you take this special platelet-rich plasma, and then you inject it into, is it a tendon, is it a bone? What area of the body specifically do you use it for?
So if you have plantar fasciitis, it can be put right into the source of the plantar fasciitis. And nowadays it's really exciting. We have a diagnostic ultrasound at the office, so we can literally see the area of concern, whether it's plantar fascia, whether it's a tendon tear, whether it's Achilles tendon. We can literally see the structure, and we can see the disease part of the structure. We can see the needle going in to the structure. A little later we'll show you an Achilles tendon where there's actually amniotic tissue going in, but we can do the same thing with platelet-rich plasma or PRP. So it's any of the tissues you need it to go into, we can put it into those tissues.
And is this something that's done in the operating room? Is it something that's done in your office? And what's the recovery like afterwards? Do you have to be out of work?
Yeah, you can do it anywhere. We actually do it right in our office. We have the ultrasound machine in our office. MRIs are typically the gold standard diagnostic study where you can see tissue disease. You can see tears in tendon, you can see splits, you can see inflammation, you can see cracks in bone. But the diagnostic ultrasound gives you real-time imaging capabilities, and we have it in our office, so you can do it right in the office. It's a blood draw. The spin on the centrifuge is about 5 minutes. So the blood draw, it's me drawing the blood. So if you're an easy stick, it's pretty quick. Sometimes it takes a little longer if you have a difficult vein. The spin itself is about 5 minutes. Sometimes we'll use a local anesthetic to the area to limit any discomfort that might occur from injecting it. If it's a larger area, if there's multiple areas within the plantar fascia or the Achilles, then PRP is a really nice choice because you usually we draw 15 cc's of blood. So that's about 3 teaspoons of blood. And that gets spun down. Typically, we get anywhere from 3 to 5 cc's of plasma of the PRP, which, as you mentioned, we call it liquid gold because it's a golden color. And that gets injected into the area. So if there's larger defects, that's a really nice option to have. The procedure itself takes, if we're doing it under ultrasound, it might take a little longer, but from 30 seconds to 3 minutes. Afterwards, you get a Band-Aid or a soft wrap. Depending on the structure involved, you might go into a soft cast and a walking boot for up to 2 weeks. And you're walking out.
That's what it is.
You might need a ride if it's your right foot, because you might need to be in a walking boot on your right foot.
And is there anything you can't do after? Can you take Motrin, ibuprofen, things like that?
You shouldn't, because again, those are anti-inflammatories. You could take Tylenol. You could use ice or heat, but we generally don't like the use of the anti-inflammatories because it will interfere with the function of the platelets. And the other thing I might add is the disease structures, the tissue tears, fasciosis, fasciitis, Achilles tendonitis, tendinosis, they're just conditions of pathology within these structures. The reason they become problematic in the first place is they don't have a great blood supply. And platelets get called into action to heal, but they need to come through the bloodstream. They need to come through capillaries. And if these structures don't have a really powerful or strong blood flow to them, you're not going to get nearly the quantity of platelets there that are needed for healing. Platelets release fibrin, and they also release factors that help with new blood vessel formation. So they actually promote blood vessel formation from within these tissues to increase your body's own ability to heal itself, and that's one of the real exciting features, and that's something that the shockwave therapy also does, which we'll talk about.
I think it's a good segue. Dr. Saviat, do you have anything else to say about platelet-rich plasma?
Well, first, Dr. Pelto, thanks for having me on the show.
You're welcome.
Much appreciated. Big fan. Been posting a lot of the videos. About the platelet-rich plasma therapy, the people who, in the general population, who have probably heard of it the most are the people who are sitting at home on their couch on Sunday watching football. And you hear about, Martellus Bennett's out getting platelet-rich plasma therapy into his shoulder, or Vince Wilfork had it into his Achilles tendon after it was ruptured. These elite, high-level athletes, these guys, obviously, sometimes they have an infinite amount of resources to do anything to heal themselves, but some of these things, they make sense to the guys that want to get back out and participate a little faster.
And also maybe avoiding surgery. In the past, if you have one of these tendon injuries, a surgical option is what you were doing in the past, sooner.
These athletes, too, were flying to Germany because the initial work was done over in Europe, Italy, Germany, and they were Tiger, Lance Armstrong, in addition to other things probably. But these procedures.
Now you can have it in Worcester.